Bismillahirrahmanirrahim. Welcome back, friends. Welcome back to another video lecture by Kami Microbiologist. I hope all of you are well and fine. Today in this video lecture we are going to see another lecture that is related to the glucose test or blood sugar test, and it is about the glucose challenge test. Okay, if you guys remember, we already talked different videos that is related to the glucose test. Like we have talked a simple glucose test, we talked about the HbA1c test. Now this is another video lecture that is also related to the glucose test, and it is about the glucose challenge test. So today we are going to explain this video lecture. My name is Muhammad Kamil Khan and you guys watching my channel Kami Microbiologist. So let's start the video. In this video, the main content is that we are going to explain. First of all, we will see the introduction related to GCT test, means glucose challenge test. Then we are going to see the requirements. Then we are going to see the test procedure. Then we will see the complication in gestational diabetes. What is gestational diabetes? We are also going to explain it. Then we will talk about the risk factors of gestational diabetes. Okay. Now let's see the introduction. First of all, that what is glucose challenge test? This test is also called glucose sensitive test. Okay, now this is actually the test which is mostly performed in the pregnant women. For what purpose? To just confirm the gestational diabetes condition. Now what is gestational diabetes condition? So it is that type of the condition, or it is the case in which the sugar level rises during the pregnancy, especially in those pregnant women that they do not have any diabetic issue. Okay, and they have high glucose level after 20 weeks. So this condition is actually called as gestational diabetes. Now remember, in this case what will happen, the female, especially the pregnant female, feel difficulties in pregnancy. Moreover, it can also the female can also feel difficulties during childbirth if the sugar level is not controlled. Now what happened in this case? So in this disease, what will happen, the placenta that is connected with the mother blood to the children. So what will happen during this stage, there is some abnormal hormone will secrete, and due to this abnormal hormone secretion, what it will affect on insulin level. So due to the insulin level, once it is affected, so what will happen, the glucose level will be rise, and due to this way what will happen, it will affect on the baby growth and development. This is a short introduction related to the glucose challenge test. Requirement. Now to perform that test, we need blood in red top, gel tube or heparin tube. You can take blood in any one of the tube. Okay, then you need centrifuge machine, you need biochemistry analyzer machine, you need weight machine, simple water. This is simple tap water. Okay, this is the blue tip. You need glucose and you need yellow tip. Now let's see the procedure. Procedure is very simple. First of all, what will you do? You have to take 50 gram glucose. You will weight it using weight machine, and you will take 50 gram of the glucose and will mix it into the 250 ml of the simple tap water, and then you have to give it to the patient. So when the patient drink it, after 1 hour, you have to perform the simple glucose test. Okay, means you will take the blood in the gel tube, red top or green top, and then you will separate the serum or plasma, and then you will perform the glucose test. Now how to perform glucose test, blood sugar test, I already explained it in detail. If you wanted to see this video lecture, there will be a link into the I button. I will give the link into the I button, so then you will watch this video lecture. Okay, so I already explained that how to perform glucose test, what is glucose test, etc. So then you will perform the glucose test after 1 hour when the patient take water having 50 gram of the glucose. Okay, now let's suppose if you see the glucose level is normal, so it means that the female do not have gestational diabetes. If the glucose level is abnormal, means if it get high, so it means the patient have gestational diabetes. Okay, so remember, this is the normal range, means the normal range is the glucose normal range. Okay, now let's see the complications. Means if let's suppose this disease is not controlled, and if let's suppose this disease would happen, what type of other complication will be caused due to this disease? So due to this disease, there will be a depression, there will be hypoglycemia. What does it mean? It means that low level of the glucose. Early birth. So due to this way, what will happen? The baby size and the baby weight is enlarged. Due to this way, what will happen? There will be early birth. Next, due to this disease, there may be the chances of type 2 diabetes if it is not controlled. Then due to this disease, there will be excessive birth weight, means the baby have excessive weight, we can say like that. Due to this disease, there will be pre-eclampsia. Due to this disease, there may be a chances of cesarean section. Cesarean section means childbirth through operation. Okay, next we have a respiratory distress syndrome in the baby, means the baby feel difficulties in respiration, or there will baby feel difficulties in respiration, or sometime in this case there will be respiration problem in the baby. So in this case, the artificial respiration will be provided to the baby. So now let's see the risk factor, that in which women there will be the risk of gestational diabetes. So those women that are obesity, they may have the chances of gestational diabetes. Those women that weight that age is greater than 25 years, that women should have chance, that women have chance of gestational diabetes. It may also be in that women that have pre-diabetes. Okay, so this is all about the gestational diabetes and glucose challenge test. I hope you get idea about this test. Thank you so much for watching. If you like this video, make sure to hit the like button, share this video and subscribe the channel. If you have question, you can write your question into comment. I will try my best to give you answer as soon as possible.